If you regularly experience something called tingling, burning sensation in your arms, in your feet, in your arms, maybe in your spine, you probably have some kind of nerve problems. In today's video, I will explain everything that you need to know about the best vitamin that really can support your nerves in the safe and natural way. Today I want to explain why vitamin B12 may be the #1 vitamin to check when to walk and you want to prevent damaged nerves after 50, especially if you have burning feet, tingling, numbness or pins and needles, weak legs, poor balance, memory problems or deep fatigue. This is not about taking one vitamin blindly, it is about understanding the signal your nerves may be sending. And why vitamin B12 is critical for the nerves. Vitamin B12 is essential for the nervous system. Your nerves are not just wires, they are living tissues. They need oxygen, blood flow, minerals, vitamins, healthy blood sugar and protective covering myelin. And myelin is like insulating around the electrical cable. When the insulation is strong, nerve signaling moves clearly and quickly. But when the insulation becomes damaged, nerve signaling becomes disoriented and, of course, distorted. My name is Mario. I'm European medical specialist. I work with the patient almost over 26 years. And my specialty, of course, is going to be nutrition and natural remedies alongside with the classical modern medicine. And I work with the patient regularly with those nerve problems for almost 26 years. And vitamin B12 is the key. Vitamin B12 supports myelin nerve signaling, red blood cell formation, DNA production, and oxygen delivery. This is why B12 deficiency can affect both the blood and the nerves. And here is the dangerous part. Nervous system can appear even before the person understands B12 is low. And some people are told your blood count is not too bad, but their nerves are already sending the signal. This is why vitamin B12 should never be ignored when the nerve system appears, especially after 50. And I'm going to give you, this is especially important for you men and women after 50. You are in unbelievable danger of losing your nerve signaling and you will have chronic inflammation because you really don't understand what is nutrition, what is natural remedies, what really can help you with minerals and vitamins. You only take chemical medications, you live unhealthy life, and I promise you, after 50, 60 years and older, your nerves will be a lot worse. Why does vitamin B12 become such a problem after 50? And the first reason is absorption. Vitamin B12 is not absorbed easily. To absorb it properly, your body needs stomach acid, digestive enzymes, intrinsic factor, and healthy stomach lining, and a healthy small intestine. And after 50, many people produce less stomach acid. Some have gastritis, some had stomach intestinal surgery, some have digestive inflammation. In short, this means especially your bowel does not work after 50. Especially if you are chronic disease, especially if you take chemical medication daily, especially if you live unhealthy life, use those unhealthy food daily. This is so easy to understand. Chemical medication with unhealthy food for the decades is going to destroy digestion. When your digestion is destroyed, your immunity is going to be very low and you will not be able to absorb any kind of minerals and vitamins properly, especially vitamin B12, and that's why your nerves are at much higher risk after 50 years and older. And I'm going to give you some information about medication. Metformin, one of the most common medication for type 2 diabetes and insulin resistance, has been associated with lower B12 levels in some people. Acid blocking medication such as proton pump inhibitors and H2 blockers can also reduce B12 absorption and use long term because stomach acid helps release B12 from the food. And the third reason, of course, is going to be diet, especially if your diet is mainly animal food. If a person eats very little meat, fish, eggs, dairy on animal products, the risk goes up. Vegans and strict vegetarians must pay special attention for the B12. And the fourth reason is going to be autoimmune disease. Pernicious anemia is autoimmune conditions where the body cannot properly absorb B12 because affect instinct factor. This can be missed for the years if nobody checked it properly. Now, of course, your nerves are going to be a lot worse, especially after 50, because you get in age. Aging is, of course, the factor, but the main reason is going to be unhealthy diet, medications for the 1, 2, 5, or maybe 10 years. This is, you really need something to understand. That's why you have peripheral neuropathy. That's why your nerves in the spine are destroyed completely. Your nerves in the legs are destroyed completely. That's why you need B12. Now let's talk about the forms of B12. Cyanocobalamin is common, inexpensive form. It is widely used and can help people, especially when its issue is simple low intake. Methylcobalamin is often used in nerve support protocol because it's one of the active forms of B12 and is commonly chosen when tingling, burning, numbness, or neuropathy symptoms are present. Hydroxycobalamin is often used in injections in some medicational settings. It may stay in the body longer for certain people and is commonly used when absorption is poor. Adenosylcobalamin is another active form, is involved in mitochondrial energy metabolism. Which form is the best? That depends on the person. If absorption is good, oral or sublingual B12 may be enough. If absorption is poor, if deficiency is severe, if pernicious anemia is present or its neurological symptoms are significant, injections may be needed under medical supervision. And this is very important. If you have clear neurological symptoms, do not waste months experience with random supplements. And this is exactly why you need MarioLab help. This is why exactly this video is only in educational purposes only. I'm not telling you right now that you can go in your local healthy store or to your pharmacy, you will buy B12 and you will remove all your nerves damage. Of course not, my dear viewers. That's why you need special protocols with nutrition and natural remedies. And that's why I always recommend at the end of my videos, call my MarioLab office from any part of the world if you have neurological problems and if you want to cure them properly in the safe way. With my expertise and my programs. B12 is just a small part how you can remove all those problems, but B12 along with B vitamin complex is unbelievably important. And one more information, not all of supplements are the good quality. This is one of the main reasons why you get sicker and sicker each year. You watch my videos and you think you will go to the first local healthy store or pharmacy, you will buy B12 and you will be healthy. Of course not. Like 99% of those healthy supplements are really poor quality, and when you take poor quality supplements for the long period of time, you really can harm yourself. That's why you need medical professional help. That's why you always call my office, and I'm gladly to help you. If you want to learn a lot more about the best tea that really can help you with your nervous system, watch my video right here. Thank you for following my viewers. See you next time.